As complex and devastating a disease cancer is, so too are the endeavours to find ways to alleviate the side effects associated with treatment. The Chris O'Brien Lifehouse has, for over a year now, been clinically trialling medicinal cannabis, specifically targeted at mitigating the nausea patients often experience after undergoing chemotherapy.
So cannabis is a drug that is it's not a drug, it's a herb, it's a plant. There's 700 different species, each part of that. So within each of those plants, there's about 100 different cannabinoids, which are different potentially effective medications. And then there's something called terpenes and other components of the plant that may all interact to help it have its medical value.
Dr. Judith Lacey, a specialist in oncology and palliative care, has a keen and ongoing interest in the medical benefits of cannabis and was instrumental in bringing the clinical trial to the Lifehouse.
We have a cannabis trial, and at the moment I think we're up to about a dozen patients on that cannabis trial, and we also have a different scheme where patients can purchase cannabis as well, and I think we're up to about 20 patients for that.
Only recently, however, have patients been able to be prescribed and administered cannabis medication outside the clinical trials. Pharmacist at the Lifehouse dispensary, Whiter Tang, says results so far have been largely positive.
The ones that the patients are purchasing has only kind of recently started. So I think we're still seeing the effects and whether it's helpful or not, but we've had patients who've come back for it and saying it's just been a miracle, medicine for them and really helpful. But yeah, we're still seeing, still evaluating a lot of the patients that just picked up the first one, so it'll be interesting to see how they find it.
Although it's early days for the trial and no concrete conclusions can be reached yet, Dr. Lacey draws on her 30+ years of experience to describe the supposed health benefits of medicinal cannabis over traditional opioids.
Say for pain, we think that for people who their pain doesn't respond or doesn't respond well to opioids or anti-nerve pain medications, it may work together with the opioids and the other medications to assist in pain control, and it may mean that you can use less opioids.
Announced early last month at the Lifehouse, Australian Health Minister Greg Hunt put in place a great deal of reform to current regulations and approval processes for patients seeking access to medicinal cannabis, in order to provide fast access for those most in need.
That was taking a very complex system that took about 4 hours to make a single application and up to 6 weeks to get a response. Took that system, which was not good for our patients, and changed it to a system. I did a script yesterday that took 10 minutes to fill in, and I had a response in 2 hours.
Other politicians in favour of cannabis legalisation, such as Senator Richard Di Natale, have been condemned by Drug Free Australia, mainly due to his advocacy for both its medicinal and recreational purposes. However, in speaking to the DFA, they stated that they are in support of medicinal cannabis, so long as it passes the standards of the Australian Therapeutic Goods Administration. We support all medications that have a therapeutic benefit, provided that they go through all due process and meet Australian standards.
We don't know if there are that many health benefits.
Okay.
We suspect there are health benefits. In medicine, what we know is we need evidence. So we can say we think, I work with a lot of patients who are taking herbs and supplements. We can't tell you that this definitely will help your symptoms. We don't have the studies to say this will definitely help.
So should medicinal cannabis be fully legalised in Australia? And what positive changes could cannabis make to the treatment of cancer?
When it's used properly and all the approval processes in place, and we purchase it from a regulated provider or compounder, I think it is good for patients to have that extra option for nausea, pain relief, or any other condition. So I think it is a good thing.
People are developing products that are at the pharmaceutical grade level. It's not just smoking a joint, having a bit of oil, having a sprays under your tongue of a nanoparticle product, a pill, and so that's where it's going to go in the future.